Aloha, welcome back to Autonomic Pharmacology. Let's move to the PowerPoint slides and get started today. Today's Autonomic Pharmacology, the second lecture in the second section of the curriculum. In the old days, there used to be 5 exams. That's how all these numbers came from. But now it's different, and I haven't renumbered anything. However, Autonomic Pharmacology is the most important section that you can know about pharmacology. I get all sorts of emails from people who say, we don't cover anything but autonomic pharmacology and in our entire pharmacology class. I get emails that say it takes them weeks and weeks to cover what we're going to cover one time today. And so a lot of courses will teach the sympathetic nervous system pharmacology completely different than the than the parasympathetic nervous system pharmacology. We're going to throw it all in together to show you how it compares and contrasts, and then you can sort it out throughout your clinical careers. Now, that being said, if nothing else, learn this. It's just a 2x2 square. Increase, decrease, sympathetic, parasympathetic. And so if you take a 2x2 square that's increase, decrease, sympathetic, parasympathetic, then you're going to have our 4 categories of autonomic pharmacology. Drugs that increase the sympathetic nervous system response, sympathomimetics. Drugs that increase the parasympathetic nervous system response, we don't like to call those parasympathomimetics. We just call those cholinergic drugs. And then there's drugs that block the sympathetic nervous system. Maybe you've heard of alpha blockers and beta blockers. Those are high blood pressure pills. And then drugs that block the parasympathetic nervous system response. You can just put atropine for number 4 in the belladonna alkaloids. And we'll get to all of that. By the way, we're going to talk mostly about 1, 2, and 4, and then we'll come back and talk about number 3 when we talk about high blood pressure. Because remember, the sympathetic nervous system raises blood pressure. It makes sense that drugs that block the system that raise blood pressure would lower blood pressure. All right, so again, 2x2 square, increase, decrease, sympathetic, parasympathetic. Give us these 4 categories right here. All right, I love this cartoon. It came out in 2005. Hopefully we'll get to the end and show you where it came from. This guy right here is my icon for the sympathetic nervous system response. He was probably out looking for lunch or dinner and came across a woolly mammoth that he thought he could take down, and then along comes Mom, and now she's ready to turn him into toenail food. And so, by the way, not only is he undergoing an adrenaline rush, a sympathetic nervous system response, so is she right there. All right, so he will be our icon for the sympathetic nervous system. So this sympathetic nervous system, you know it as the adrenaline rush. When most people teach this, they'll take a big book and slam it down and make some loud noise and scare everybody. And they'll go, oh, you see how your heart rate's going up because I scared you. And that's just the adrenaline response, that autonomic nervous system response to fear, anger, and stress. That's why people get angry, their blood pressure goes up. All this because of the sympathetic nervous system. All right, and I think of it as being sympathetic to the fact that if it doesn't kick in, you're going to get stomped on. All right, so it's sympathetic to your body's needs in your moment of desperation. That's what the sympathetic nervous system is about. Well, outside of that system is the parasympathetic nervous system. It's your rest and digest system. This is the chance when your body, when your brain has a chance to relax, then your parasympathetic nervous system kicks in so that you can repair and renew and digest. All right? So these will be our 2 icons: sympathetic nervous system, parasympathetic nervous system. Again, we're going to talk about drugs that increase the sympathetic nervous system response, drugs that increase the parasympathetic nervous system response, drugs that block the sympathetic response, and drugs that block the parasympathetic response. And we'll divide them up into our little 2x2 square. There's our drugs that increase the sympathetic nervous system response. That's why there's a little green square around my icon for the sympathetic nervous system, because sympathetic agonists and pathomimetic drugs are going to increase the sympathetic nervous system response. Well, cholinergic drugs are going to be parasympathetic agonists. They are going to increase the things that are going on with his organs in this state. All right, and see, notice these are opposites. One of them is a sympathetic increaser. The other one a parasympathetic increaser. All right, and then we can talk about blockers. We'll have sympathetic blockers, sympathetic antagonists, and they'll be denoted by the red blocking sign on top of the icon. And then there's drugs that block the parasympathetic nervous system response as well. So again, we've got our 4 categories: drugs that increase the sympathetic nervous system response, drugs that increase the parasympathetic nervous response, drugs that block the sympathetic response, and drugs that block the parasympathetic response. There's only 4 categories, and it's just 2 by 2: increase, decrease, sympathetic, parasympathetic. Okay. What makes it confusing is all the terminology that goes with it. And so drugs that increase the sympathetic nervous system response will be called sympathomimetics. Drugs that block the sympathetic nervous system response will be called sympatholytic, lytic meaning to stop or break down. So maybe you'll hear the sympathetic agonists, the sympathomimetics, referred to as alpha or beta agonists. Maybe you'll hear the sympathetic antagonists, the sympatholytics, referred to as alpha or beta blockers. And so we'll talk about this section when we talk about high blood pressure. On the parasympathetic side of things, maybe you'll hear it called parasympathomimetic if it mimics, or parasympatholytic if it blocks the response. Really what we hear is cholinomimetic and anticholinergic drugs. And because the autonomic nervous system uses muscarine as a receptor, you might hear these drugs called muscarinic and anti-muscarinic drugs, and they mean exactly the same thing, and that's what makes this complicated. Well, it's as if there aren't a whole lot of words that all mean exactly the same thing in autonomic pharmacology. You're going to notice that these 2 completely different systems are going to have same effects when you're blocking one or an agonist of the other. And so think about epinephrine, adrenaline. If we give somebody adrenaline, what's going to happen? It's going to stimulate their sympathetic nervous system. It's going to stimulate the end organ synapses and cause an increase in the sympathetic nervous system response. So epinephrine, the sympathetic agonist. All right. However, we can get the same response by blocking the system that slows heart rate down. So if we block the system that slows heart rate down, we're going to get exactly the same effect, raising heart rate. And we can do this by blocking muscarinic receptors using atropine. And so later on, we're going to see that there are drugs that are sympathomimetic that have the exact same effect as a drug that's atropine. But atropine is not a sympathomimetic. Atropine is an anticholinergic drug. And so that's what starts making this confusing, but I'm telling you now that's why these have similar effects. They're opposite systems that do opposite things, so blocking one is going to give you similar effects as the agonist on the other side. And same thing over here, and we'll parse this out as we go along. All right, quick side note, autonomic means automatic. You do not have control over it. It works automatically. You really have less control over the sympathetic nervous system side. When the sympathetic nervous system side is activated, usually all the organs that are affected by the sympathetic nervous system will work together. You do have a little bit more separate control over your parasympathetic nervous system, your rest and digest system. When we were in college, we used to play with all sorts of electronic equipment, and we'd do biofeedback. And so we'd put something on our heart and skin galvanometry, I think that was called, and we could hear these sounds that would respond to our heart rate and how sweaty we were. And then we would meditate on slowing our heart rates down and learning to have control over our autonomic nervous system. Not really. You have a little bit of control over your parasympathetic nervous system. You pretty much have zippity-doo-dah for control over your sympathetic nervous system. All right, so the autonomic nervous system controls the function of many organs. That's why many drugs that affect the autonomic nervous system affect many organs. All right, and this is on my PowerPoint slides, and yet I get emails from people, and they say, I never really realized that the drugs that affect the autonomic nervous system can affect many different organs. Okay, so I want to make that very clear. Drugs that affect any of the autonomic nervous system the drugs that affect any of the autonomic nervous system organs are going to affect all the other organs as well. And so these will be eye drops, and they'll be for the eyes. And are the eyes controlled by the autonomic nervous system? Yes. And so if it involves acetylcholine or cholinergic blockers or beta blockers or any of that, what is it? It's going to have effect on other organs as well. And that's the point that I want you to understand. This drug is for the heart. Yeah, well, it affects the lungs and the eyes and the pancreas and the bladder and all that business too. Oh, this drug is for the eyes. Yeah, it's going to affect all the other organs as well. Oh, well, this drug is used in the neuromuscular junction. Yeah, and it affects all these other organs as well. And that's what you're going to see. And so it's not the differences between the drugs in the autonomic nervous system, it's the similarity. So there's a great list of drugs in your clinical discussion questions. For now, you guys are going to use the clinical discussion section, clinical discussions that are in the lectures to help you understand what direction this is going. So my lectures are designed for people sitting and watching on TV. Those of you who are holding the clinical discussion questions realize what direction we're trying to move this. I would urge you to take the clinical discussion for 2.1 and 2.2, autonomic nervous system pharmacology, and take a look at that. There's some very important drugs. And what I want you to see is the similarity across the cholinergic drugs. See the similarities across the anticholinergic drugs. See the similarities for all the sympathomimetic drugs because of this right here. And you'll notice that in the warning section. And they'll use this drug for this, and they'll say, oh, that over there is an unwanted effect. And you'll use the same drug to get that effect over there. And they'll say, oh, well, that's the effect, and this one over here is the unwanted effect. And that's what makes the concept of side effect really difficult. And so what I want you to know from autonomic nervous system pharmacology, if nothing else, is this right here. Drugs that affect the autonomic nervous system are going to affect all of the organs that are affected by the autonomic nervous system. And that's these organs right here. The heart, the blood vessels, the bowels, the pancreas, the ureter, the bladders, the eyes, pupils, lacrimal glands, salivary glands, lung, airways. All of these are controlled by the autonomic nervous system. All of these are affected by the autonomic nervous system. And so if we give a patient a medication for the heart that affects the autonomic nervous system functioning in the heart, then we can expect a response from blood vessels, bowels, pancreas, ureter, bladder, eyes, pupils, lacrimal glands, salivary glands, lung, airways. If you're in the dental hygiene business, what they want you to know as you go through pharmacology is which drugs cause dry mouth. That's the most important thing you can know in dental hygiene pharmacology. What drugs cause dry mouth? What drugs interfere with the functioning of the salivary glands? And I would suggest that any drug that interferes with the function of the salivary glands is going to interfere with the function of these as well. Now, I use the term interfere loosely. Sometimes we use these systems, every time we use these systems to improve our patient's outcome. But sometimes we need things to go one direction, sometimes we need them to go the opposite direction. But the point I'm really trying to make is this right here. Drugs that affect the autonomic nervous system will affect the heart, blood vessels, bowels, pancreas, ureter, bladder, eyes, pupil, lacrimal gland, salivary gland, and lung airways all at the same time. All right, so if it's a drug for the bowels, it's going to affect all this other stuff. And you'll see that on the warning labels. You'll see all the time, be careful using in glaucoma. Don't use in glaucoma because people with glaucoma, they're very sensitive about autonomic nervous system drugs that can affect the eyes because that can make glaucoma worse. All right. Peripheral means outside of the skull and spinal cord. Central nervous system means inside the brain and spinal cord. That includes your eyeballs. Your eyeballs are part of your central nervous system. Your voluntary nervous system is the stuff that you can move. All right. And so those are all different than the autonomic nervous system. And again, we're dividing the autonomic nervous system into two systems, the sympathetic adrenaline fear, flight, fight system, and then the parasympathetic nervous system, the rest repair and digest system. Again, sympathetics are adrenaline, that comes from the catecholamines. Parasympathetics are driven by acetylcholine. Acetylcholine is the neurotransmitter used by the parasympathetic nervous system at the peripheral end organ. All right, so think about it. Make a list. Can you tell me all of the effects that are going on with this guy right here? Okay. Maybe the running is voluntary, but everything else that's going on that we're going to talk about is completely automatic. All right, so what's going on with his heart, with his eyes, with his bowels, with his lungs? What do you think's going on? All right. and her too. All right, so when we talk about the response, when we talk about the sympathetic nervous system response, really what we're talking about is the pharmacologic action of epinephrine, adrenaline, our sympathomimetic drug, drugs that are prototypical sympathomimetic drug because that's your body's sympathomimetic neurotransmitter. So epinephrine, the heart is pounding. So what happens when we give somebody epinephrine, adrenaline? It causes their heart to beat with more force. And that's because the heart is innervated by a sympathetic neuron that secretes norepinephrine onto the beta receptors. That can speed the heart rate up, but the heart rate can also sense adrenaline coming from the adrenal gland in the blood, and that has access to those receptors, and so that speeds the heart rate up as well. And that is mediated by receptors. We call those beta-1 receptors. Beta-1 in the heart. All right, well, what else is going on besides this fast heart rate and strong heartbeat? Well, his blood pressure is sky high. Why? Because epinephrine affects alpha receptors in the systemic blood vessels. So I told you I told you earlier, or in the previous lecture, when these alpha receptors sense the effects of adrenaline, it causes vasoconstriction, and this raises blood pressure. It's like putting your thumb over a garden hose. You shoot the water higher into the air, and that's quite simply our definition of pressure. And so making vasoconstricting raises blood pressure. Right? So a blood vessel muscle is innervated by a sympathetic neuron from the sympathetic chain ganglia, and that neurotransmitter is primarily norepinephrine, and the receptors can also sense adrenaline from the adrenal gland, kicking up the response, and all those receptors are called alpha-1 receptors. All right, the lung airways are wide open. Why? Because he needs to ventilate better, because he needs more metabolism. He's consuming an enormous amount of oxygen to support all that muscle work, so he needs to ventilate. He needs to ventilate well. And so notice epinephrine is a bronchodilator, vasoconstrictor, bronchodilator. All right, so don't confuse those things. And you'll notice if you look at the second messenger systems, they'll work exactly in the opposite way. All right, so here epinephrine is a bronchodilator because when we're undergoing an adrenaline rush, we need to ventilate. We're not worried about cleaning out the dust and cleaning up our lungs. We need to ventilate as much as we can. And if you have the opportunity to work in an emergency and the privilege of taking care of a child, if the child has asthma, maybe you'll give them something called racemic epinephrine, adrenaline, as a bronchodilator. So sympathomimetic drugs are bronchodilators. And that's because the lung smooth muscle has, the bronchial has a smooth muscle, and a sympathetic neuron goes to it, secreting norepinephrine, and the lung bronchial senses adrenaline from the adrenal gland as well. These are beta-2 receptors. Remember, beta-1 heart, beta-2 lungs. All right, well, what else is going on? He needs more blood going to his muscles because they're working really hard to run away. And so what do we do to get more blood to our muscles? Well, one of the strategies is to stop the blood supply going to the gastrointestinal tract. We need to stop digestion, stop peristalsis, and send the blood to the muscles. It gets a little complicated early on when he first starts running. His bowels, his gastrointestinal tract will function in a manner, his bowel and bladder will function in a manner to offload excess weight that is not necessary for his propulsion. However, that's the exception. So early in the sympathetic response, your gastrointestinal tract will dump weight very quickly, automatically, and then after that, stop. And so that's the effect of epinephrine, stopping the gastrointestinal tract. And by stopping this gastrointestinal tract, we can send blood to the muscles instead. And that's why you hear the wives' tale, oh, don't get in the pool after you eat, or don't get in the ocean after you eat. You'll get cramps. And some people are very suspect that and other people are not. But that's where that comes from. All right, something else that happens, he's not worried about the sun being too bright. He's trying to take in as much information into his brain as possible so he can find a hiding place from the woolly beast. And so his pupils are dilated so he can get as much vision into his face as possible. So that's another effect of epinephrine. That is another effect of sympathomimetics. Raising heart rate, raising the force of contraction, dilating lung airways, vasoconstricting, stopping the bowels, dilating the pupils. These are all the effects of epinephrine, adrenaline. These are all the effects of sympathomimetic medications. And so why is all this occurring? The sympathetic nervous system, which uses primarily norepinephrine as the neurotransmitter as well as adrenaline. The adrenal gland gives adrenaline, epinephrine. That's why these are called adrenergic neurons in the adrenergic system. So adrenergic in this case means sympathetic nervous system. Now remember, the adrenal gland has two parts. There's a middle part, that's the adrenal medulla, and that's where all this is coming from. And so when we talk about the adrenergic part of the adrenal, we're talking about the middle part. The outer part is the cortex, and we do not use the adrenal word when we're talking about adrenal cortex. We'll use cortico words for the outside. We'll talk about adreno words when we're talking about the adrenal medulla, the inside. When we go through endocrinology, we're going to realize that the endocrine organs are like several organs crammed into one space. When I go see the dentist, I think of that big building as my dentist's building. That's the dentist building. But when you go in, there's more things going on in the building than just the dentist. There's all sorts of things going on. And the same thing with our endocrine organs. We'll say, oh, the adrenal gland, that makes epinephrine. And we're like, well, that's the inside part. The outside part does something else. And so when we talk about sympathetic nervous system medications, sympathomimetic drugs, maybe you'll hear them called adrenergic drugs. Maybe you'll hear them called the adrenergic system. And again, that comes from the word adrenal, as in adrenal gland, where epinephrine comes from. So adrenergic agonists are called sympathomimetics. And epinephrine, adrenaline, is the sympathomimetic adrenergic agonist that we have been talking about. And what did we say it did? It increased heart rate. It also increased the force of contraction, increased inotrope. Constricted blood vessels, and this raised blood pressure. It dilated lung airways so we could ventilate more efficiently. And this system dilates pupils as well. Now, dilating pupils raises pressure inside of the eyes, and that's really problematic for a patient with glaucoma. So every sympathomimetic medication has a warning because of this right here in the use of glaucoma. And that's what makes things complicated for people. They're like, hey, I thought this was a lung drug. Well, it dilates pupils as well. Oh, I thought this was a blood pressure drug. Oh, well, it's a problem for patients with glaucoma as well. So that's what I want you to see when you're reading the labels, when you're going to Daily Med and looking at the package inserts, the FDA monograph for these drugs. I want you to see that all the sympathomimetics, even though they have all different names and indications, their effects are all the same: increasing blood pressure, dilating lung airways, dilating pupils. And dilating pupils is very problematic in somebody with glaucoma. All right, so albuterol is an adrenergic beta agonist. We use it in asthma. It's our rescue inhaler, our rapid-acting beta agonist, a short-acting beta agonist. And so what can we expect? We can expect a direct effect of increased blood pressure and increased heart rate. Those are the direct effects of a sympathomimetic. And this is what it should say in the book as its effects: increased heart rate and increased blood pressure. Okay, then you get a pharmacology book out and they'll say, oh, well, it increases blood pressure or decreases blood pressure, or it increases heart rate and decreases heart rate. And that tells us absolutely nothing. And so what I want you to understand is sympathomimetics, their direct effect is to raise blood pressure. And so the reason they say either or is this. The body notices that something is raising blood pressure, and the body will compensate and lower the blood pressure. And that's why they say, oh, it could lower blood pressure. It's like, no, the drug raises the pressure, and your body can compensate and lower the pressure in response. And they don't bother to separate the direct effects from the body's compensatory effects. And I don't need you to know any of that. I want you to know the direct effect of some pathomimetics. And again, that's why it's really hard to understand when you read this in other books. They're like, well, it could increase heart rate or decrease heart rate, or increase blood pressure or decrease blood pressure. And they give you this either or as if there's like no point in learning it to begin with. And so the direct effects are this right here. And then if the body compensates and puts this in a different direction, which we don't really see that much of, that's where all those opposites come from. And don't worry about the body's compensation. We will later on in a clinical setting, but right now, to really understand autonomic pharmacology, I want you to understand its direct effects, because people have come into me and said, well, the book says exactly the opposite of what you're telling us. And so those books, they just need to go in the trash. All right, let's talk about beta blockers. Again, we're talking about how drugs that affect one organ are going to affect other organs. So beta blockers are drugs that are used to treat high blood pressure. We'll also use the same beta blockers in an eye drop to treat high blood pressures. All right. And so we just got through, I'm going to give you a hint where we're going. We just talked about a beta agonist opening lung airways. All right. So guess what beta blockers do? Sure, they lower blood pressure and they can lower eye pressure, but beta blockers are very problematic in people with chronic obstructive pulmonary disease and asthma. So if you look at the warning of a beta blocker, they'll say, oh, this is for the heart. If you watch the thing on TV, oh, it's a miracle drug that's going to save your life. And in fine print, it says, do not use in asthma, do not use in people who have chronic obstructive pulmonary disease. So not only do we avoid them a lot. And even people with glaucoma, they'll put the eyes drops in their eyes. They can have effect of their lungs because of the drops getting into systemic circulation and affecting the lungs. And so again, this is the point I'm trying to make, is that drugs that affect one system are going to affect all the systems in the autonomic nervous system. And so what do they use for beta blocker overdose? They use glucagon, which comes from the pancreas. It's the opposite of insulin. It seems completely unrelated. However, early on we said drugs that affect the autonomic nervous system are going to affect eyes and blood pressure and pancreas as well. And so that's why you're going to see a drug that comes from the pancreas used in beta blocker overdose. And it's not that I expect you to memorize that stuff. I just want you to be aware that drugs that affect the autonomic nervous system are going to affect all the organs. So then if I get an email saying that I never mentioned that in lecture, I know you guys don't watch lecture. So again, do you understand why beta blockers are making asthma worse? We use beta agonists to open lung airway, so it makes sense that beta blockers would have the opposite effect and be very problematic in people with asthma. And we'll talk about asthma when we get to 3.4. We'll talk about asthma after we go through central nervous system pharmacology. All right, let's talk about the other half of all this. What is the opposite of this? I think I'm going through this right now. I'm getting short of breath. I feel my heart pounding. Oh, well, this is the opposite of that. We get too much of this. Not enough of this. Okay, so let's spend more time doing this. Less time doing that. Right? Especially quit being this person over here. All right? Don't be that person. Be this person. All right? Again, as a human, what are your outputs? What are your efferents? Are your efferents quite simply your expression of motor movement? All right, so here this dude is super relaxed. He's, let's say he's doing his yoga. All right, so what happens when you do your yoga? All right. Well, you're experiencing the effects of the parasympathetic nervous system on your organs. Now, the relaxing has to come in between your ears. Taking big, deep breaths is part of that. All right, and so then what happens when we're relaxing? Well, our heart rate slows down. and digestion starts to speed up. Last time I gave this lecture, somebody said, well, is that why I pass gas when I do yoga? And everyone laughed, and they thought that was funny, and they thought that was a ridiculous question. And here's the slide right here. Yes, if you're relaxing and taking it easy and focusing on deep breathing and self-healing, then sure, you're going to speed up peristalsis in your bowels. That's what we expect. All right, something else that happens when we're renewing and relaxing and digesting is that our airways will start to narrow from our face to the bottom of our lungs. They'll get more wet. There'll be more secretions, and the airways will narrow. Why? Because we're filtering out debris, and then all that junk we breathed in while the beast was chasing us around. We have to cough that up. That's called pulmonary toilet. And pulmonary toilet doesn't seem like an important thing, but if you look at people who are severely neurologically impaired, their number one cause of death is pneumonia because of a failure to properly toilet their lungs. And so proper toileting of the lungs requires narrow airways so we can cough up loogies more efficiently, and then wet to lubricate that stuff so we can get it out. And so drugs that affect sympathetic tone, like acetylcholine drugs and cholinomimetic drugs, they narrow airways and make them wet. And that improves air filtration for most of us that are healthy. However, wet, narrow airways are disastrous for someone who's asthmatic. And so as we go through this, you'll notice that drugs that are cholinomimetic drugs that affect the parasympathetic nervous system are going to be problematic in asthmatics for that reason right there. And so your body thinks you're doing you a favor. Hey, I'm filtering out all that junk. And if you're an asthmatic, like you're not doing, the body's not doing us any favors. The body's trying to make things worse. And so that's why we have to know how the autonomic pharmacology drugs work across the different systems. The parasympathetic nervous system uses acetylcholine as the neurotransmitter, and all of the receptors are muscarinic. So that's going to be really easy. When we talked about sympathetic nervous system, we had two neurotransmitters, and we had beta 1 and beta 2. We only talked about alpha 1, but we'll talk about alpha 2 someday. All right. But parasympathetic nervous system is real easy. At the end organs are muscarinic receptors that sense the acetylcholine. So acetylcholine will always be the neurotransmitter we talk about in parasympathetic nervous system pharmacology. Muscarinic receptors will always be the receptors. All right, so let's talk about direct cholinergic agonism, direct cholinomimetics, like bethanechol. Bethanechol is similar to acetylcholine in structure. It's a synthetic form of acetylcholine, and so it'll be a cholinergic muscarinic agonist. And so you'll hear it called a cholinergic drug, you'll hear it called a muscarinic drug, maybe somebody will call it a parasympathomimetic drug if they like using big words. All right, and we can use this as a drug to stimulate bowel and bladder function. Now, this is a pharmacology course, so I have to talk about these things. In my surgical resident experience, I can assure you ambulating the hallways is the best way to stimulate bowel and bladder function after a surgery, as well as incentive spirometry. All right, so on a side note, if I have a post-operative patient and I want to stimulate their bowels and their bladder, the most important thing they can do is use their incentive spirometer and ambulate the hallways. And that being said, we can use medications as well. I don't think I ever used a medication to stimulate somebody's bowel or bladder function, but this is what uricoline is, bethanechol. And so it acts like acetylcholine on the muscarinic receptors, increasing the parasympathetic nervous system response. And even though it's used to stimulate bowel and bladder function, remember the cholinergic agonists narrow lung airways and make them narrow, and so, or make them more wet. And so we're going to avoid, there'll be a big warning sign on this about asthma and chronic obstructive pulmonary disease. Same thing with the cholinesterase inhibitors. Remember, acetylcholinesterase breaks down acetylcholine, so if we inhibit that system, we raise acetylcholine levels and get the effects of the acetylcholine, and that is increasing the effect of the parasympathetic nervous system. And so this is great for all sorts of things that we talked about in the beginning of neurotransmission. But again, acetylcholine drugs, acetylcholinomimetic drugs like cholinesterase inhibitors are avoided in asthma because they narrow the lung airways and make them more wet. And so you look at any of the cholinesterase inhibitors, they'll have a warning about using in an asthmatic or somebody with chronic obstructive pulmonary disease. And we talked about these during neurotransmission. So again, the cholinesterase inhibitors are used for all sorts of things. We've gone through this list already. You guys can read it again. But keep in mind that these cholinomimetic drugs that are used for myasthenia gravis, glaucoma, anticholinergic poisoning, and reversing the effects of non-depolarizing muscle relaxants, Sjogren's syndrome, and Alzheimer's disease, you'll notice there's a warning about using them in asthmatics and people with chronic obstructive pulmonary disease. That's what I want you to see from these lectures, how the boxes cross over to each other in those 4 sections. Because the way I see other people teach it, especially when they're, well, it could do this or could do that, I'm like, well, you know, what's the point of even learning that if its effects are equivalent to a coin flip? And I think I've made my point. All right, let's talk about parasympatholytics, drugs that block the parasympathetic nervous system. All right, well, it's real simple. That drug is atropine. There are others. There are the belladonna alkaloids. Bella, beautiful. Donna, woman. They used to use these as eye drops to make their pupils big because that had some kind of magical effect on men when they were busy being power brokers. And there are great, now there's entire books that are written about where belladonna alkaloids got their names. And so that being said, atropine and the belladonna alkaloids are anticholinergics that I want you to know. There are others in the list that is in your clinical discussion section. Get that out. If you're going to be in the professional pharmacology business, you definitely need to be able to have those discussions with other professionals. If you're taking this so you can be a better consumer of medication, it's great. But if you're going to be a healthcare professional, you need to get the clinical discussions out and make sure that you can answer those questions quickly and easily. In the past, those turned into little assignments, and now it's just back on you. You need to be able to answer all of those in between your ears, especially for boards. All right, so the problem with cholinergic agonism is you'll hear them called muscarinic agonists. I'm sorry, you'll hear them called muscarinic antagonists. Let me repeat. The problem with cholinergic antagonism is all the words. Maybe you'll hear them called cholinergic antagonists. Maybe you'll hear them called muscarinic antagonists. Maybe you'll hear it called anticholinergic. Maybe you'll hear it called muscarinic. Maybe you'll hear it called parasympatholytic. They all mean the same thing. And so if you read about atropine, you might get these 4 different descriptions about the drug. And then somebody will say, oh, it's a chronotrope. It's a positive chronotrope because it speeds up heart rate. Yeah, but it does a lot more than that. And so atropine not only speeds up heart rate, we'll use it in the treatment of emergency bradycardia, which is slow heart rate. But atropine also causes mydriasis, pupil dilation. Atropine is going to block peristalsis in the bowels, and so diarrhea is partly due to too much peristalsis in the bowel. We can use belladonna alkaloids and atropine to slow the bowels down. And then we'll use atropine as the antidote for organophosphate poisoning. And so we'll use anticholinergic drugs to treat cholinergic poisoning, and we'll use cholinergic drugs to treat anticholinergic poisoning. It won't be that simple when we get into central nervous system pharmacology. All right, so remember when we went across the squares, sympathomimetic drugs had similar effects of anticholinergic drugs. All right, and because this system is the opposite of this opens lung airways, the parasympathetic nervous system closes lung airways. So if we block that system, we're going to open lung airways. So you're going to see 2 separate classes of drugs used as short-acting beta agonists. Short-acting rescue inhalers, short-acting bronchodilators, and one of them is albuterol. It's a sympathomimetic, but we'll also use ipratropium, a synthetic form of atropine, as a bronchodilator as well. So, duoneb, if it comes from a nebulizer, Combivent is what it's called when it's an inhaler. And again, we'll get to asthma when we get to 3.4. But these Combivent contains two drugs. One of them is albuterol. People know that as Provenal, the little rescue inhaler, the short-acting beta agonist, SABA. And it's a sympathomimetic drug. Other people have Atrovent. It's ipratropium. See that atropine word in there? That means ipratropium is just a synthetic form of atropine. It has anticholinergic effects. Maybe you'll hear it called antimuscarinic or parasympatholytic. But it has the same effects even though it's through completely different pathways. This is going to affect beta receptors that are sensing norepinephrine and epinephrine, and this is blocking the system that is sensing muscarinic, sensing acetylcholine. And so that's why we get the same effect through two different pathways. And so keep this in mind as we're going through things like asthma, that here we can use a sympathomimetic as a bronchodilator, or we can use an antimuscarinic drug as a bronchodilator. I'll make the point right now that Combivent is a single trade name for something that has two drugs. And what I want you to know about pharmacology is that even though it has a single name, that does not mean it's one drug. It's two drugs. If they put two drugs in the combination, they can give it one name, but it's not what the name is, it's what's in it, and there's two drugs in it. If there's a combination drug if there's a combination drug with one name and it has three drugs in it, like a lot of the anti-HIV drugs we'll talk about, it'll be three or more drugs in one. I'm here to tell you that's not one drug, that's three drugs that are put together and labeled as one. That's why when we talked about botanical substances and using them as drugs, well, that's lots and lots of chemical signals inside of a single name, and we would consider that lots and lots of different drugs in the case of a botanical. Here we're going to make it simple. Combivent contains two drugs, albuterol and ipratropium. And when you look up drugs that have combo drugs, I want you to understand the two drugs separately rather than together. Hey, all this is really simple. We're either making the heart rate go up and down, we're making the blood pressure go up and down, we're making eye pressures go up and down, we're making lung airways open or close. We're either relaxing the bladder or making it less relaxed. We're either stimulating the gastrointestinal tract or slowing it down, all right? Because there's times we need to speed the heart rate up. Their blood pressures, their heart rate is really low. Oh, we need to speed it up. Oh, their heart rate's way too fast. Wait, we need to speed it down. Oh, the pressure in their eyes is way too high. Great, we need to bring that pressure down. Some drugs bring the pressure up. That's really problematic for glaucoma. Some drugs will bring the eye pressures down, and that's what we use to treat glaucoma. Some drugs will open the lung airways. Those will be the ones we want to use in chronic obstructive pulmonary disease. Some drugs will close the lung airways, and we want to avoid those in people with asthma and chronic obstructive pulmonary disease. Sometimes people, they lose the tone in their bladder. They'll have bladder atony without tone, and so we'll stimulate it. Or maybe the opposite happens. Maybe they have a bladder that's spasming and we need it to relax. Same thing with the gastrointestinal tract. Is it moving too fast? We'll use drugs to slow it down. If it's moving too slow, maybe we'll use drugs to speed it up. And it really is just this simple, up or down. All right, so let's go through this. All right, so here's my icon for sympathomimetic, and here's my icon for anticholinergic. And to start out, you can just think epinephrine and atropine, all right? And dilating the pupils is called mydriasis. All right, so watch the pupils because I spent time animating this back when I had time for that sort of thing. All right, so that's mydriasis. Mydriasis is dilating the pupils. And you'll see that sympathomimetic drugs are mydriatic drugs, and you'll notice that anticholinergic drugs are mydriatic drugs. And I'll tell you right now, mydriatic drugs are problematic in somebody with glaucoma. And so you'll know that sympathomimetic drugs will have a warning for people with glaucoma, as will anticholinergic drugs. So drugs like epinephrine, the sympathomimetic, or anticholinergic drugs like belladonna alkaloids and atropine are mydriatic drugs. They cause mydriasis. All right, constricting the pupils is the opposite. All right, so now I have the opposite icon up here. We have sympatholytic drugs and we have cholinergic drugs that can cause constriction of the eyes. And so this causing constriction of the eye pupils, the constriction of the pupils, miosis, is something that we'll do to help somebody with glaucoma. And as we go through the glaucoma drugs, eventually you'll notice that there's beta blockers and there's also cholinergic drugs involved as well. All right, the bottom line here is sympathomimetic drugs are drying. Anticholinergic drugs are drying. So those of you in the dental hygiene business eventually will get down to the mouth and the larynx, and we can talk about airways too. And I'll tell you right now, sympathomimetics, dry. Anticholinergics, dry. And so that's your answer when they ask you, what classes of drugs are most common to cause dry mouth? And you'll say, well, that's either sympathomimetics or anticholinergics. So they can dry lacrimal glands as well as the rest of the upper airways. All right. So these cause dry eye. All right, well, what was Sjogren's syndrome? Dry eye. So what kind of drugs are we going to use in that? Oh, well, we'll use mostly cholinomimetic drugs to stimulate lacrimal glands, make not only the eyes but the mouth and the airways wet. All right. We don't see this too much over on this side because the sympatholytic drugs have a much more effect on the cardiovascular system before they start affecting other organs in the autonomic nervous system. But they still will, but we're not going to use beta blockers to stimulate tear production. We'll use cholinergic drugs because these drugs, the sympatholytic drugs, will have a far more profound effect on the cardiovascular system than the other autonomic organs. All right, so sympathomimetics cause dry mouth. If you have congestion and you want to decongest and dry your nose and your face from some cold that you might have, then you'd use a sympathomimetic drug like Sudafed or ephedrine. We don't really use the anticholinergic drugs so much for this. However, if you're in the anesthesia business and you're having a hard time intubating somebody, you want to dry them up in their mouth. As long as they can tolerate the increase in heart rate, you can use atropine to dry them up in the mouth so you can get intubation. They'll teach you all that when you go in the anesthesia business. All right, so again, sympathomimetics, dry. Anticholinergic drugs, dry, and that's from your face to the bottom of your lung airways. All right. Exactly the opposite, and we're going to see the same thing until we get done with lungs. All right. Sympathomimetics, dry. Anticholinergics, dry. Sympatholytics, wet, although sympatholytics are much more affecting of the cardiovascular side, but cholinergic drugs will wet the respiratory mucosa as well. And that's why we avoid these in asthmatics. All right. What are the bronchodilators? The bronchodilators are the sympathomimetics, and the anticholinergics are bronchodilators. And they'll be used in asthma. We talked about Duoneb. It has Proventil in it, which is albuterol, a sympathomimetic drug, and it also has ipratropium in it, an anticholinergic drug. It has the combination of these two because these both cause bronchodilation to happen through completely different pathways, like physiologic agonists. All right, well, this is what we want to avoid in asthma, drugs that narrow the lung airways. And what are those drugs? Beta blockers, all right, sympatholytic drugs, and cholinergic drugs. Cholinomimetic drugs narrow lung airways, and we have to avoid these medications in asthmatics. And it doesn't matter if the beta blocker is made for the eyes or the cholinomimetic drug is made for whatever reason. They'll tell you, oh, well, this drug affects the heart. And it's like, no, the drugs affect all of the organs in the autonomic nervous system, and that's the point we're trying to make today. So sympatholytic drugs like beta blockers and cholinergic drugs like the cholinesterase inhibitors cause bronchospasm. I think we made that point. Drugs that increase the heart rate are called chronotropes. Positive chronotime, like a chronograph is a watch. Trope as in tropics, meaning to grow, to encourage growth. And so positive chronotropes speed up heart rate. That's epinephrine, and the sympathomimetic drugs, that's the anticholinergic drug like atropine as well. Both these classes of drugs increase heart rate through completely different pathways. However, they'll eventually get to the conduction system, and we'll talk about that in 2.6. So, sympathomimetic drugs and anticholinergic drugs cause tachycardia. Positive chronotropes. Right? Drugs that increase the force of contraction are called positive inotropes. Ino from energy. Anticholinergic drugs are not really considered positive inotropes. So we got lucky on that one. Right. Drugs that slow the heart rate down cause bradycardia. Slow heart rate down, they're called negative chronotropes. And so you might read about something about, it's negative chronotropic effect. Right, well, acetylcholine, cholinergic drugs have a negative chronotropic effect on the heart. Remember, we're trying to slow heart rate down when we're relaxing and renewing and digesting, but there might be situations where we don't want a cholinergic drug slowing our heart rate down. Maybe our patient is just barely getting by with the heart rate that they have, and we give them some cholinergic drug for some silly reason, and now they start to go into failure because of the negative chronotropic effect of that cholinergic drug. And again, beta blockers, we know they slow heart rate down, and we'll talk about that when we get to high blood pressure and cardiac rhythm. So sympatholytics are bradycardic drugs, as are cholinergic drugs. All right, vasoconstriction is contracting the smooth muscle to raise blood pressure. From a clinical pharmacology side, that vasoconstriction is carried on by the sympathetic nervous system. All right. I get all sorts of comments about the parasympathetic nervous system causing vasoconstriction from a clinical pharmacology point of view. I don't think any of that is relevant. When we talk about vasoconstrictors, we're talking about sympathomimetic drugs. Sympathomimetic drugs are vasoconstrictors raising blood pressure. All right, and so you're going to see that in the pharmacology books. They'll say, this causes vasoconstriction, and immediately you think that raises blood pressure. All right. So sympathomimetic drugs are vasoconstrictors raising blood pressure. All right, so the opposite is occur. Sympatholytic drugs, here specifically alpha blockers, will vasodilate and cause blood pressure to drop. And so when we use an alpha blocker as a vasodilator to lower blood pressure, they're going to have a problem going from laying down to standing up. They can have orthostatic hypotension and pass right out because we're blocking the system. And so when we start somebody on an alpha blocker, we want to put them on the very smallest dose, and we want them to be very careful and thoughtful as they go change in their position from laying to sitting and sitting to standing. And so if you put somebody on an alpha blocker for the first time, you'll warn them when they get out of bed, the first thing they want to do is just dangle their feet off the bed and sit up for a little bit. And then when they feel like they're ready, just stand up a little bit and make sure they're ready to stand up, and let the body adjust before they start walking away from the bed. Because if somebody's on alpha blockers and they pop right up out of bed and stand up, there's a good potential for them to have orthostatic hypotension and pass out, have syncope from it, or at least feel dizzy like they're going to fall down, as in pre-syncope. All right, so be on the lookout for this. Drugs that are vasodilators are great at lowering blood pressure, but they can cause orthostatic hypotension. And when we get to high blood pressure, we'll start with sympatholytic drugs. And when you look at the clinical discussion section, the clinical discussion for the sympatholytics are in high blood pressure. All right, so we'll use drugs to relax the gastrointestinal tract and slow peristalsis. All right, well, stress slows the bowels down. The effects of epinephrine slow the bowels down. and so the adrenergic system slows the bowels down. And so when they go to when you take somebody to surgery, their brain might be asleep, and hopefully their brain's asleep. However, the bowels are well aware that something's going on, and they can sense that increased sympathetic nervous system stimulation and that increased rush of adrenaline. And so many times after stressful situations in a hospital or surgery, their bowels will come down to a screeching halt. We'll call that an ileus, and so we'll be on the lookout for that. However, maybe their bowels are moving too fast and we want to slow them down. If we have diarrhea, we'll use an anticholinergic drug to slow them down. There's other options, but we're looking at the effects of acetylcholine drugs and sympathomimetic drugs, cholinergic drugs, and sympathomimetics. And here we see anticholinergic drugs slow the bowels down. The sympathomimetics do as well. However, their effect on cardiovascular medicine, the sympathomimetic effect on cardiovascular function is so profound that we don't really even get to all the other effects. And so that's when we relax the bowels, we're going to use an anticholinergic drug. And same thing with stimulating peristalsis. We can stimulate peristalsis with cholinergic drugs. All right. We talked about bethanechol stimulating bowel function. We talked about cholinesterase inhibitors stimulating bowel function. And yeah, the drugs that block the sympathetic nervous system, they can they can speed up peristalsis as well. But again, their effects on the cardiovascular system are going to be so pronounced that we're probably not going to notice this effect before the cardiovascular effects. And so that's why we stay on the cholinergic side of things when we're trying to affect bowel and bladder. That's why cholinergic drugs like cholinesterase inhibitors will be used to stimulate the gastrointestinal tract. We can use cholinomimetic drugs as well. All right, well, they can affect the pancreas as well. And so when we start going through diabetes mellitus, we'll see that drugs, sympathomimetic drugs and sympathomimetic drugs and cholinergic drugs have an effect on the pancreas as well. And so that's why you'll see the treatment for beta blocker overdose is glucagon, which comes from the pancreas. And so we're not going to forget about this as we go through, but this gets more complicated, and we'll talk about that when we get to endocrinology, and that's section 4. All right. Some drugs are going to relax the bladder and the urinary tract, smooth muscle. All right, so your ureters, they undergo peristalsis as well. That's why colicky, and that's why kidney stones have this colicky pain to them. But some drugs, sympathomimetic drugs, can slow peristalsis as well. So sympathomimetic drugs, but mostly anticholinergic drugs, slow peristalsis, not only in the gastrointestinal tract, but the ureters as well. And sometimes we want the opposite. Sometimes we need to stimulate this system, and so cholinergic drugs will stimulate that system. And then again, the sympatholytics, their effects on cardiovascular will be much more profound before we start noticing these effects. And so that's why you'll see cholinergic drugs used if we're trying to chemically restore stimulation tone to the bowel or the bladder. And so some people, maybe after surgery, they have a bladder that has no tone, atony, and we can use medications to stimulate that bladder to have tone. In the opposite situation, maybe they have bladder spasm, and maybe we'll want to use an anticholinergic drug to treat that bladder spasm. This is what I want you to know as you go through the monographs. Pick one drug out of every. I name in the clinical discussion section, I name the most important drug for you to look up in that class. And so I want you to take time to look at the syllabus, see how to research drugs online, and take a look at some of the drugs that I've mentioned in the different sections. And what I want you to see is I don't need you to memorize the dose or the name and the trade for every generic. That'll come as you keep looking stuff up. This is what I want you to see right here when they talk about unwanted effects. They'll say, oh, this is the effect of the drug, and then, oh, there's all these other effects. And they're not other effects. They're all the effect of a drug on many organs is just like a car key. Oh, well, that starts the car. Yeah, well, it opens the trunk and opens the door and the glove compartment and that thing in the middle. That key does all sorts of stuff. It's not just one thing. And it makes sense when it's a car key. Oh, it starts the car. Yeah, well, it does all this other stuff too, right? And the same thing with locks and keys in the autonomic nervous system. That key is going to have an effect on a lot of different locks, and they'll say this key, oh, it's for the eyes. Well, it's going to have this effect right here. Oh, this key, it's for the lungs. You're going to have all these other effects as well, and that's why we go through this in this manner. It's just that simple, right here. All right. I have 30 minutes left, and I think, well, we'll talk about this cartoon. 2005, Cox and Forkham, they might still have a website. They had generally offensive cartoons. Unless you're far to the right, then you might think they were funny. But back when the paleo diet came out, they made fun of the new USDA dietary guidelines telling you to avoid fatty meat, get your daily exercise, and eat your veggies if you're not too busy avoiding fatty foods. And so that's where this cartoon came from. And I collect political cartoons and all sorts of interesting cartoons from